Good evening. My name is Jennifer Johnson. I'll present for Dr. Nydia's Psychology of Leadership class an overview of neuroscience. This is for Aspen University, Module 6 assignment. In the agenda, I'll cover what neuroscience is, how it's emerging, what's relationship to leadership, and how it can benefit a work setting. Neuroscience is the scientific study and understanding of the nervous system, which includes the brain, the spinal cord, and the peripheral nerves as well. Neuroscience entails everything about us, how we think, how we move, and who we are. The goal of the 100 billion small cells or neurons in the brain are to communicate with each other, our thoughts, our feelings, our emotions, and our memories. Those small neurons are connected by neurotransmitters which work between the synapses or the gaps of the neurons. So we have in neuroscience a study of the brain and nervous system. We have neurons, over 100 billion, that communicate with each other. And we have neurotransmitters designed to operate between those neurons to send the messages. The neurotransmitters have many names. I'll just name a few of them. ACH is one that involves our motor movement and memory. Dopamine, and many of these terms we hear in marketing and sales pitches, especially in social media, on television, in our advertisements. Dopamine, motor movement and alertness. Serotonin, when we think about sleep. Mood control. The endorphins, which involve pain control. Norepinephrine, which involves our alertness and our arousal. And after COVID-19 pandemic, GABA, which involves our sleep issues. As we continue to look at these neurons and neurotransmitters, there are actually three components that involve the thoughts, the actions, and the emotions. Sensory input, what information and data are we taking in? Integration, how are we putting it all together? And sensory output, what's the result? What's the integration look like once we've put all those sensors, that sensory output together? So if we're looking at leadership impacts in our work setting, the sensory input would be the leadership, the management, supervisors, taking a look and gathering the information, collecting the data. What's going on? Why is it going on? How long has it been going on? Are there concerns in areas that we need to be focused on? The integration then happens with putting those pieces together and considering or looking at the options. And then the sensory output, making and sharing those decisions. So we gather the data, we piece together what we have, and then we draw some conclusions about next steps. When we look at leadership impacts in neuroscience, it's important to consider that the brain operates in quadrants. I'm only going to talk about the left and right side for this presentation. But those that prefer to operate on the left side of the brain typically use logic, order, very linear thinking, compared to those on the right side of the brain, big picture, communicators, love to think out loud, thinking while they're talking. So leadership impacts in our workplace. It involves the brain and the nervous system in our planning, in our problem solving, certainly in our decision making, in our decision assessment, and certainly in effective and timely communication. The impact of leadership in our workplace involves studying and researching and designing, that it's a constant, robust environment where leadership is acting in an effective manner. They're developing and organizing, they're predicting and forecasting, and certainly constantly building teams. The team rebuilding may look different. If we're organizing by whole brain, looking at left and right side of the brain, not only may it involve interdepartmental reorganization, but it may involve reorganization of the team members themselves. Leadership needs, when we look at neuroscience, and impactful and effective leadership involves a willingness and desire to want to learn about neuroscience and its impacts. Understanding team member and support and buy-in is essential. There's got to be education and training for all to learn about the impacts of neuroscience. And there's got to be strategic planning. It may look different now. If we're involving the whole brain and team members from the left and right side of the brain, it may look like a brand new environment. When we look at strategic planning. When we look at organizational needs, we need to be concerned with what's an identification of the needs. Sometimes we solve the wrong problems. So identifying clearly what the needs are, prioritizing those needs, information sessions to help the team understand where we're headed, team member assignments, maybe voluntary, or you may have to do a little prodding. And there's got to be timelines with rubrics and assessments in order to evaluate the progress. If we're looking at neuroscience and we're looking at the psychology of leadership, there's got to be a refocus and a reframing of the culture. There may be a different lens. Maybe it's not structural. Maybe it's human resources. Maybe it's symbolic. Could be political. But it involves identifying the problems and having problem-solving sessions. Imagine a problem-solving session where there's no right or wrong answer, but there's a brainstorming, since we're talking about the brain and neuroscience. All hands-on-deck celebrations and testimonials have to happen to continue to encourage team member support, and quarterly and annual reviews, absolute necessity. So what are the goals? We're looking at increased performance. We're looking to boost processes and procedures and operations. We're looking to enhance our team climate, cooperation, and attitudes. And the goal is improvements in organizational behavior. There are references to support this presentation. Thank you for your attention and your focus.